Hi friends, welcome to my channel. Today we are going to see about the black fungus, one of the dangerous disease in the world compared to COVID. Here we are going to discuss about what is black fungus, what are its effects, how it looks, and what is its diagnosis, and what is its sources, and what is the treatment procedure. Okay, so let's start with the black fungus. Introduction. Black fungus, it is a rare and deadly fungal infection called mucormycosis or black fungus. So black fungus, also we call it as mucormycosis, and it is a rare and deadly fungal infection. So black fungus, it is the one of the type of the deadly fungal infection called as mucormycosis or black fungus. So where it is going to affect? Black fungus, once it enters into our body, what are the sites or what are the parts it is going to affect, such as it affects the sinuses. Sinuses means it will be small hole like structures, passages. It helps to pass the air or sinuses. It's the sinuses, the brain, and the lungs. And the lungs and can be life threatening in diabetic or severely immunocompromised individuals, such as cancer patients or people with HIV or AIDS. To whom and where it is going to affect? It affects in the sinuses, the brain, where it is going to damage the sinuses, brain, lungs, and life threatening in diabetic. Most probably it affects the diabetic or severely immunocompromised individuals who are all having less immunity powers due to this kind of diseases, such as diabetic and such as cancer patients or people with HIV or AIDS. People who are all suffering with the HIV or AIDS, the like that peoples, they are going to affect from the black fungus. And let's have a look how it look like. See, this is the structure of the black fungus. It looks like this structure under the microscope, and this is the combination of black fungus and coronavirus, COVID-19 coronavirus, and it is the black fungus which is affected to the trees, how it is going to growth on the trees, and it is the viral structure of the black fungus, genetic structure, how it is look like under the microscope in the body specimens like saliva or like blood cells. Okay, next, in the detailed structure of the black fungus. This is the structure of the black fungus. Next, we'll see what are the signs and symptoms which will occur once the black fungus is enter into our body. The symptoms of mucormycosis depends on where in the body the fungus is growing, such as the symptoms of rhinocerebral mucormycosis includes one-sided facial swelling. See, based on the symptoms, we are divided so many times. The black fungus is divided into types as per as based on that symptoms. That is, first one is rhinocerebral symptoms, that is related to sinus and brain. It includes the one-sided facial swelling. The facial swelling is occurring one side of the face, and headache, nasal or sinus congestions, difficulties to pass the air in the nasal cavity or sinus congestions, black lesions on nasal bridge, black marks on the nasal bridges, lateral sides of the nasal bones, nasal bridge or upper inside of mouth that quickly become more severe, inside of bright or upper inside of mouth that quickly become more severe, and in some cases they will get the fever. The second one is pulmonary mucormycosis based on the symptoms. Under that pulmonary mucormycosis, symptoms like fever, cough, chest pain, and shortness of breath. See, this is entirely depends on the respiratory system. It is going to collapse the respiratory system. Symptoms of pulmonary mucormycosis are lung mucormycosis. The symptoms such as fever, cough, chest pain, and shortness of breath. Next, we'll move on to the another symptom, signs and symptoms which are going to affect the skin. Cutaneous mucormycosis or skin mucormycosis. Cutaneous mucormycosis can look like blisters or ulcers. So once this skin mucormycosis occurs, means the blisters or ulcers are going to appear on the skin and the infected area may turn black. Once the blisters or ulcers occur, the infected area may turn black, and other symptoms include pain, warmth, excessive redness or swelling around a wound. So in that patches or areas, symptoms include pain, warmth, it will become a little tenderness, warmth, excessive redness, it will become a red in color, redness or swelling around a wound. Around that wound, you can feel the swelling. That's the signs and symptoms of gastrointestinal mucormycosis. So what are the signs and symptoms will occur into the gastrointestinal mucormycosis? First one is abdominal pain. See, name itself is suggesting gastrointestinal. This problem are going to occur into the gastrointestines. That is abdominal pain, nausea and vomiting, and gastrointestinal bleeding. These are the major signs and symptoms in the gastrointestinal mucormycosis. Next one is disseminated mucormycosis. Disseminated mucormycosis. Disseminated mucormycosis typically occurs in people who are already sick from other medical conditions. So it is going to occur who are already suffering from other medical conditions. So it can be difficult to know which symptoms are related to mucormycosis. Due to this, we cannot able to find out easily which can it can be difficult to know how which symptoms are related to mucormycosis. And patients with disseminated infection in the brain can develop mental changes or coma. Due to these unknown factors, sometimes the patients with disseminated infection in the brain can develop mental status changes or coma. It may result the patient may lead to the coma. Next, we'll move to the sources of the black fungus. So sources where mucormycosis comes from. So when from where it is going to come, that is the fungi that cause mucormycosis live in the environment. Particularly, it will comes from the environment, such as mucormycosis, the group of fungi that cause mucormycosis. So what is that fungus name? That is mucormycetes. It is the group of fungi that cause mucormycosis are present throughout the environment, particularly in soil and in association with decaying organic matters such as leaves, compost piles, and animal dung. So basically it is present in the environment, particularly in soil in association with decaying, decomposing matters, decaying organic matters such as decomposing leaves, compost piles, and animal dung. Here it is the main source of the black fungus. And some more sources, they are more common in soil than in air, and in summer and fall than in winter or spring. It is more common in soil than in air. When we are comparing to air, it will most probably present in the soil, and in summer and fall than in winter. It is going to fall in the summer and is going to grow more in the winter. And most people come in contact with microscopic fungal spores every day, so it is probably impossible to completely avoid coming in contact with microcytes. These fungi are not harmful to most people when it is going to contact through microscopic fungal spores. And however, for people who have weakened immune systems, breathing in mucormycete spores can cause an infection in the lungs or sinuses, which can spread to the other parts of the body. See, overall having the weakened or less immune system in their body, through for that people's breathing in mucormycete spores can cause an infection in the lungs or sinuses, which can spread to the other parts of the body. Next, we'll move on to the types of fungi that cause mucormycosis. What are the types of funguses that can cause the black fungus? Several different types of fungi can cause mucormycosis. These fungi are called mucormycetes. and belong to the scientific order mucorales. See, several different types of fungi can cause mucor. Different types of fungi can cause the mucormycosis. These are belongs to the these are called it as mucormycetes and belong to the scientific order mucorales. It belongs to the mucorales scientific family. The most common types that cause mucormycosis are Rhizophus species and mucor species. Most common type of causing factors of black fungus are Rhizophus species and mucor species. Other examples, it includes Rhizomucor species, Syncephalastrum species, and Cunninghamel Bartholobetite, and Apesomyces and Listhemia, formerly Absidia, Saxenia, and Rhizomucor. These are the species can cause the black fungus. And we'll move on to the risk factors. What are the risk factors? Mucormycosis is rare, but it is more common among people who have health problems or take medicines that lower the body's ability to fight germs and sickness. So overall, this is the mucormycosis is rare condition, but it is more common among people who have health problems, or are having the health problems, or whose people are taking the more medicals to improve their body's stability to fight germs and sicknesses. Certain groups of people are more likely to get mucormycosis, such as diabetes, especially with diabetic ketoacidosis, especially in the diabetic case, especially with going to affect in the diabetic ketoacidosis cases, and persons who are all suffering from the cancers, and persons who are all gone for the organ transplantations, and people who are taking the stem cell transplant, and neutropenia, that is low number of white blood cells, and long-term corticosteroids use, usage of corticosteroids in long manner, and injection drug use, drug addicts, injecting of the drugs, injection drug use, and too much iron in the body, iron overload, or hemochromatosis will be occur, skin injury due to surgery, burns or wounds, and prematurity and low birth weight for neonatal gastrointestinal mucosis. So these are the risk factors of the black fungus. Next, we'll move on to diagnosis. So what type of diagnosis you can see based on the medical history. We have to collect the medical history, symptoms you have to observe, physical examination has to be done, and laboratory test when diagnosis is mucormycosis, such as your lungs or sinuses might collect a sample of fluid from your respiratory system, and tissue biopsy will be done under a microscope or fungal culture, and imaging tests such as CT scan of your lungs, sinuses, or other parts of your body, depending on the location of the suspected infections. Next, we'll move on to the treatment. Mucormycosis is a serious infection and needs to be treated with prescription antifungal medicines, usually amphotericin B and fosconazole or isavuconazole. So these are the medicals antifungal drugs we can use, such as amphotericin B, fosconazole, or isavuconazole. And these medicines are given through a vein, that is amphotericin B, fosconazole, and ivanaconazole are mouth through the oral. Fosconazole or ivanaconazole can be preferred. Other medicines including fluconazole, orisazole, and echinocandidins, but do not work against fungi that cause mucormycosis. Often mucormycosis requires surgery to cut away the infected tissue. Once it's occur on the skin, particularly on the skin, it is going to affect that part. So we have to cut and remove that affected parts. Next, steroids reduces inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronaviruses. So steroids helps to reduces the inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronaviruses. But they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic 19 patients. So This is the about the black fungus. If you like this topic, and thanks for watching. If you like the topic, subscribe my channel and comments and share. Thank you.